Hi, hello dear students. Today we are going to see the first unit of obstetrics and gynecological nursing. Today we are going to look after some of the history, how the obstetrics and gynecology started into the earth. And then we are going to see about the current trends which has been going on in obstetrics and gynecological nursing. As a nursing student, we wanted to know. And also we are going to see some of the topics and legal and ethical issues which will be related with our subject. Coming back to the obstetrics, as you all know, obstetrics is an subject which has been dealing with the female reproductive system and also about the pregnancy, labor process and the postnatal period. If I call obstetrics, it's a wonderful and a greatest nature's gift from God above in human beings' life. Every human beings wanted to reproduce their own cells into the human world. As like you see me, I am a mother who I wanted to give birth to a child who resembles me and wanted to reproduce my whole family into an offspring. That's how the obstetrics helps in the production of population. And coming back to the obstetrics, let us start with a small introduction. As we all know, it's a very complex process. A woman getting pregnant and going into labor process, delivering a baby and crossing the postnatal period is such a wonderful gift or a wonderful greatest miracle by the nature because she brings out her own offspring into the world. And the science which is dealing with about all these obstetrics, that is the pregnancy, labor and the postnatal period, is a science and art which we call it as obstetrics. Today let us see some of the terminologies and concepts which will be often we will be using in the subject in the forthcoming days. The obstetrics is a terminology which has observed from Latin word called obster. And what does this word obster means is to stand by. What is standing by? If I wanted to take care of a person, I have to stand nearby the person for a longer time and wanted to see whether how I can be an helpful hand to them. So here, when the mother goes into pregnancy, labor process and delivery, and then during the postnatal period, there will be a woman or a nurse who will be standing nearby them, taking care of the mother and the child during the whole process is called by as a name obster or a person standing by. So here, during the prenatal period and the childbirth and the postnatal period, it's a specialty which a human being will be standing by a woman who is undergoing all these processes is called as obstetrics. And the next terminology which has been related to that is also we wanted to see. Here it is a medical practice. We call that as the gynecology. What is gynecology? Gynecology is something, it's a medical practice dealing with the female reproductive system. You can see here a doctor holding a picture of reproductive system in the hands. So any doctors who's been taking care of the female reproductive system are called as gynecologists, and the subjects which deals with these reproductive organs and its functions or its malfunctions, we call it as gynecology. Literally outside the medicine, we call that as the science of the women, and already we know all the gynecologists can go as an obstetricians also. So an obstetrician can become a gynecologist and a gynecologist can be an obstetrician also. The medical surgical specialty which is concerned with the women's pregnancy until that means the 9 months or 9 months plus 7 days of a pregnancy period, and after the delivery, if the mother is going to undergo into a diagnosis, a treatment of disorders or the female reproductive system, everything will be coming under gynecology and obstetrics. And that is why the medical care of the pregnant woman is dealt with obstetrics, and the female genetic diseases will be dealt in gynecology, and they both are developed in a historical path in a different way. Means first the obstetrics started and then they have been started with the gynecological studies. So coming deeper into the history, this is so important and it will be a very informative class today, as because the history comes from the olden period. You can see here people talking about the evolution of human beings in the world. Some say or some theory states that from monkey or from apes the human man has been started arising. Whether we believe it or not, that's a different thing. But midwifery is as old as the history of human species. So we say that if from apes the human beings has been emerged or evolutions came. But is that is true or not? Apart from that, midwifery is from the period when the human got evoluted. And there is an archaeological evidences also. You can see the second picture. There is a sculpture, archaeological sculptures, which has been engraved on the walls with the stones of some of the historical places. You can see they demonstrate a woman is delivering and a person is conducting delivery, and this has been evidenced in the 5000 BC, that is before Christ period. So what I wanted to tell you is the emergence of midwifery has started from before Christ period itself. For that, we have some of the references from the Holy Bible also. There is some chapters called Exodus chapter 1, 15 to 22. You can see there are Hebrew midwives called Sipporah and Puah, and they were been conducting deliveries for the women, those who were living in the Holy Bible period of Old Testament. And there are many evidences in the Bible. You can see Genesis 35 chapter verses 70. There is a verse saying like this, for Rachel, you are having another baby. So there is an evidence of a twin pregnancy here. Rachel has already delivered a boy baby, and again she got pain, and she was shouting in the labor pain, and the guy who was conducting the delivery was telling, don't worry Rachel, there is another boy coming. So this has shown the evidence of even multiple pregnancy and delivery during the ancient Holy Bible period. And also there are so many books which tells about the Egyptians who had spoke about midwives in the Bible, who have Hebrew women. They are from lower caste people, and they were giving birth to the children. And also there were literatures found in the books and also in the Holy Bible about their first midwives were found in those period. So after the Holy Bible period, there comes the Hippocrates period, that is about 460 BC, that is before Christ. There was a person who called Hippocrates, and he was called as the father of scientific medicine, and he was been organizing and training the particular midwives by under his supervision. And he was the first person to tell that the fetus will be fighting inside the mother's womb to come out of to this environment or external environment. And that's how he was telling that the baby inside the mother's womb has to fight inside the placenta and the membranes, and it has to come outside through the vagina into the external environment. This is what he was organized, and he was learned, and he was giving training to the midwives under him. And next came in the history about Aristotle, and he was in the period of 384 to 322 BC, and he was called as the father of embryology. And this person has first described about the uterus and the female pelvic organs, and he was giving the essential qualities of the midwife. He was telling, if you wanted to be considered as a midwife, what qualities you should possess. So that's all the things he was being emphasized by the father of embryology, who is Aristotle. And after that, during Hippocrates period and then Aristotle period, there were no specific books to learn about obstetrics. And after that, in the period of in the period of 2nd century, Soranus was a man who has written his first book, which was being specialized in obstetrics and gynecology. And these books were used all around the world by the people of midwives society for about 1500 years. And this Soranus is the first man who told about vaginal speculum, who was talking about the advice on cord care, and also he was talking about wet nursing, how to feed the baby and how to take care of the baby was taught or advised by the person called Soranus. This is how from the ancient period, that's how the obstetrics has been taken into emergence, and people started giving interest on that, or people started giving too much of attention towards the obstetrical cases in the society. And the first anatomy was drawn by a person called Leonardo da Vinci. You might have heard about him in the year 1452 to 1519. This is a person who drew the Mona Lisa picture. and he made the drawings of pregnant uterus. And after this 15th century, after the 15th century, that means in the year 1500s, there were so many changes were happening in the world regarding the obstetrics and its books. In 1513, the first book of midwifery was printed in the language, German language of Germany, and it was based on the teachings of Soranus. I said Soranus has written a book which was so popularly used over 1500 years. So those books, based upon that, the first book was written, exact obstetric books was written in the German country and in German language. And in 1540, this first book in German language has been translated to English, and thereby it has been widely used everywhere throughout the world. And in the year 1543, Vesalius is a person who opened a full-term pregnant in a lower animal. Maybe it could be a dog or it could be a smallest lower animal. He opened that, a mammal, and he was shown this is a pregnant uterus, and he extracted the fetus and demonstrated the uterus as a single chamber organ. Heart, it's a 4-chamber organ, but when you cut the uterus and see, it's a one single chamber organ. And this was first told by Vesalius because he opened a lower animal pregnant uterus, and then he extracted the fetus, and there he showed that uterus is a single organ, single chambered organ. And after this books emerging, same like that, during the 15th century only, the first school of nursing has been started to teach and train the midwives worldwide. And this was done by Ambrose Paré in the year 1510 to 1590. This person actually laid most of the foundations of modern obstetrics. Modern obstetrics in the sense what we are following now, most of the things he has been laying the foundation for the modern obstetrics. Like he first introduced or performed the internal podalic version. You may know about that. Internal podalic version is something when the baby is in transverse position or transverse lie, the baby cannot be delivered properly. So he did a procedure called internal podalic version, where this man introduced this hand into the uterus and one hand above the abdomen, that is gravid uterus, and he then rotated the baby from the transverse lie to the longitudinal lie, and that we call it as internal podalic version. And he first performed that, and skillfully he delivered a woman, and that was the first delivery which has been delivered in the bed and not in the stool, because in the ancient periods the labor was conducted by sitting position, and there was a stool called labor stool, but it was not sufficient, or it is not helpful that enough, because a woman has to sit in the labor stool for a longer duration until her labor process is getting completed. So Ambrose Paré is the first person. He laid that from the stool he has been transferring the labor mothers into the labor bed. And he also sutured the perineal lacerations. During vaginal delivery, there can be an abnormal lacerations which can happen while the mother pushes the baby outside. So after that lacerations, this is the first person who have been suturing it or repairing the perineal lacerations. So you can see here, this is a sculpture or drawing showing about a person sitting in the labor stool and delivering the baby. And this is exact pictorial effect of a labor stool. And this person, Ambrose Paré, has turned that into a midwifery or labor bed. And also, he founded a school in midwives. He founded a school for midwives in the country France at a place called Paris. And he had a student who is called as Louise Bourgeois. And she was a student of the Ambrose Paré. And she is the first lady who recommended induction of labor for pelvic contraction. So once she started learning under Ambrose Paré, this is the person who is called Louise Bourgeois, who is the first person who was recommending labor induction for a person who is having pelvic contraction. You may know what is pelvic contraction. Pelvis will be not adequate for a baby to come through it. So for such mothers, if you can have an induction of labor, maybe you can go into a normal labor process, is what she recommended. And then during 17th century, there was about changes which is happening from the normal labor. If normal labor is not possible. Many of them died during that period. And what can be happened or what can be done to save the mother who is not able to deliver the baby normally? So there comes a person called Julius Caesar Aranci, and he was the first person who conducted a labor under cesarean section. You can see in the second picture, there was a cut made in the abdomen and the baby was extracted outside, and it was named after the person called Caesar and Julius Caesar, and cesarean section came into existence. And he was advising cesarean section who was having a contracted pelvis mothers. So even though you do induction of labor for contractions, it is not possible for a mother to labor delivery the normal process, because contraction of pelvis anytime cause congestions in the baby and birth asphyxia or fetal distress can be happened, and thereby maternal mortality rates and infant mortality rates or stillbirths can occur. So this Julius Caesar is the first person who has recommended cesarean section by cutting on the abdomen or then taking the baby outside as a procedure called cesarean section was emerged. And from this, the book which was being wrote has come up to 17th edition, thereby the book which was written by Soranus and then it was being translated into English was having 17 editions in that book, because so many people after that started editing it, and the 17th edition was running and who were following that book for obstetrics alone. And again during 1578, or we come back to the next to the 16th century, if you see the later 15th century and the early period of 16th century, that is 1578 to 1657, a person called William Harvey, he is called as the father of British midwifery. He first wrote an English midwifery book. I told you the book which was first written in Germany was then converted to English, but it was a conversion, a translated book. But William Harvey is the first person called as a father of British midwifery, was from London, first wrote the English book, and he also described about the fetal circulation and the placenta. You will be learning in the forthcoming classes about what is fetal circulation, and you might have known about placenta and its functions. So the structure of the placenta, what is fetal circulation, what is ureteroplacental circulation was all given by or described by the person called William Harvey, and he was called as the father of British midwifery. And he was the first person to deliver the placenta by massaging the uterus. So you may be knowing that at the third stage of labor, when the placenta is not separating or delivered properly, you can massage it during the contractions upper on the abdominal area, and that may create contractions and that may help you in the expulsion of the placenta, separation and expulsion of the placenta. This was first given by or first presented by William Harvey, the father of British midwifery. And he also initiated the study of uterine sepsis, or after delivery, when the mother is in the puerperal phase, that is postnatal period, he was also identifying there were so many mothers who was dying out of uterine sepsis. So this person is the first man who introduced or who started or who initiated what is sepsis and how it is formed. And French King Louis XIV in the year 1663, in the 16th century, he was a king. And as we all know, that time there will be so many kings named after the same name, and they will be called as King 1, 2, 3, 4 and 5. So this King Louis, he is a French king called as Louis XIV, and in the year 1663 has been employing, or he employed a Paris surgeon to attend one of his mistress in labor. One of his wife was in labor process, and he appointed a person, or we call him as a surgeon, who is from Paris to take care of his mistress during labor. And that man has delivered the baby properly, and the woman was saved, and so he was honored him with the title called Achachor. Achachor means who assists a woman in childbirth. Achachor is a honorable name given to a person who is assisting a woman who is giving childbirth. So this is the first honor name which was been given by King Louis XIV for a Paris surgeon who has conducted a successful delivery for one of his mistress. And then later, the French Achachor, or a Paris surgeon, who has been getting help from the king, and he started a first school of midwifery where almost all of the Europeans started studying there. And next, during the 17th century, Marie Curie, he is a physician who is called as the greatest physician during 17th century. He described the attitude of the fetus in the womb. What is the attitude? How the baby will be along with the uterus. We say the attitude of the fetus is flexion or extension, like that. Okay, so that attitude of the fetus inside the uterus was being first learned by Marie Curie, and who is called as the greatest physician during the period of 17th century. Now, more upon 17th century, there were so many things has been discovered. Let us see one by one. The first was Chamberlain, who was a person in 1675. He described the obstetric forceps. You can see here, today we have so many forceps in our hands, short forceps, long forceps, straight forceps, high-end forceps, mid-cavity forceps and all. And it has been named after the person who invented it. Chamberlain was the first person to design the obstetrical forceps in the year 1675. And after that, William Smellie in 1697 and 1763, he was also called as the father of British midwifery along with William Harvey. This person actually explains the mechanical process of the labor. When I ask you about the mechanical process, you may be knowing like how the baby is getting engaged, flexion, descending, and then internal rotation of the head. Like that, there are so many mechanisms which will be happening inside the fetus along with the attitude of the pelvis and the uterine cavity. Okay, so this has been first manifested or first explained by the person called William Smellie, and so he was called as the father of British midwifery again. And not only that, he also introduced some of the instruments like pelvimetry. You know, pelvimetry is an instrument which will be measuring the size of the pelvis to identify the contracted pelvis. So this instrument was used first by William Smellie. And then cephalometry, this is to measure about the cephalus, that is the head circumference or head size. And also he was the person who found a lock for the obstetrical forceps. Obstetrical forceps was first designed by Chamberlain in the year 1675, and this had no lock in it. So when you're putting pressure or when you're putting traction in it, there will be uneven traction which will be held, and that can be creating damage to the head of the baby. So William Smellie has thought that there must be a lock so that we can give only limited amount of traction which will not be overboard when we are applying it on the fetal head. And so there will be less chances of getting fetal head damage. So he found the first lock system in the obstetrical forceps. And then in 1772, John Leake is a person who replaced the obstetrical stool by a specialized bed. I already told you, another person who was there in the previous was finding about the stool to be replaced, and he was a specialized bed he took, but it was being actually replaced, but he told that it will be good. But this John Leake was the first person who actually changed the bed stool system, and he has to change it into bed system. And continuing in the 17th century, in the year 1773, Charles White is a person who first stated about the puerperal fever, which is infectious, and he used lime as disinfectant. You know, after the delivery of the mother, during the postnatal period, there can be more chances of puerperal sepsis. Infection can be crossed from the vagina due to the lochia presentation, or otherwise due to the lack of personal hygiene during that time. There were so many puerperal sepsis cases which was being identified by Charles White, and he thought that this is because of some infections which is caused by the microorganisms. And also he started using the lemon, that is, we casually use lemon, and this lemon was used as a disinfectant for washing hands and everything. And Fielding Old is a person in the year 1710 to 1789 first described the normal mechanism of labor and first performed the episiotomy. Already I told you William Smellie was a person who taught about the mechanism, but Fielding Old was a person who was explaining the normal mechanism of the labor properly, and he described it properly on the basis of the William Smellie. And this person has been the one first started with episiotomy. You all know what is episiotomy. Episiotomy is a surgical incision which will be given on the perineal area to increase the pathway through the vagina, so that the baby can be coming out easily without creating any perineal laceration while the mother pushes the baby outside. And this was first found by Fielding Old. And Gordon in 1975, he described the puerperal sepsis, and it was by a wound contamination on the placental site. So already we know Charles White has been talking about the puerperal fever, and puerperal sepsis is also caused by the wound contamination. Where is the wound? Actually inside the uterus, where the placenta is being attached. We call that area as a placental site. So once after the delivery of the placenta, that area will be wounded and it takes much time to get healed. And during that time, if any unhygienic things causes infection from the ascending area into the uterus, will cause puerperal sepsis, was described by Gordon in the year 1795. And then comes the 18th century. In 18th century, there were again so many improvements happened in the history of midwifery. That is, Francois in the year 1818 was first recognized the fetal heart sounds in the pregnant uterus. So we all know today we are using fetoscope, stethoscope or Dopplers to identify the fetal heart sounds, on keeping that instruments on the topmost layer of the abdomen after finding out the lie and presentation of the fetus inside the uterus. So this was first described by, or first recognized by, he was the first person recognized that upon the abdomen of a pregnant uterus, you can even hear the fetal heart sound, was done by Francois in the year 1880. And in 1847, there is a person called James Young Simpson who used chloroform first in the obstetrics as anesthesia. Chloroform used as anesthesia in the obstetrics was first done by James Young Simpson in the year 1847 for some of the procedures which has to be taken, especially cesarean sections. They used chloroform as anesthesia. And in 1862, our Florence Nightingale, you all will be knowing about her. She organized a small training along with the King's Hospital, and a school of training was started for midwives. So she was the head of the person who was organizing that, but not alone, along with the King's Hospital in 1862. And in 1961, the Semmelweis demonstrated the cause of the puerperal sepsis, the scrubbing the hands in chloride lime. I told you already there was a person who was named Charles White, who identified the puerperal fever, was using lime for disinfectant. And the Semmelweis was also another person who has been using lime as a disinfectant. He used for washing the hands from while taking care of the patient, or from transferring from one patient to the another. So let us put this point up and this point down, because it is 1861 and that's 1862. So Semmelweis demonstrated the cause of the puerperal sepsis by scrubbing the hands with lime as a chloride and lime as a disinfectant solution to avoid infections. And when coming to the late 18th centuries, that is in 1879, a person called Louis Pasteur, so all of you might have learnt in your first year about microbiology. Louis Pasteur is the father of microbiology, who has wrote a thesis on puerperal sepsis because he was the first person who identified infections or caused because of the microorganisms. So he wrote a thesis, and that was been most helpful for identifying the reasons of the puerperal sepsis in postnatal mothers. And then after the First World War, there was the first antenatal clinics was being started for the first time during the First World War. And then there was a French obstetrician who is called as Mariqueux. He was the person first reported the cesarean section in 1668. You must be knowing about Mariqueux. I already said Mariqueux about him in the last slides. And 1876, Pororo, he was performing the subtotal hysterectomy. Subtotal hysterectomy is total removal of the uterus for some reason or some gynecological problems or some uterine diseases. He first introduced the subtotal hysterectomy in the year 1876, and his name is Poraro. And after the 18th century, coming to the late 18th century and 19th century, that is early 19th century, there was a person called Max Sanker in the year 1882. He first sutured the abdominal wall. After cutting the cesarean section and extracting the baby outside, the abdominal walls has to be sutured. So this was the first person how to make suturing and what materials can be used was the first given by Max Sanger in the year 1882. And in 1912, a person called Krink introduced a lower segmental vertical insertion. First cesarean section was on the top of the uterus, and it was called as upper segment cesarean section. And later it was causing so many abdominal wall damages, and intestinal organs were affected because they all cut directly into that. So in 1912, Chronic is the person who introduced lower segment cesarean section, and it was being vertical insertion. And Munro Kerr in year 1926 first introduced the technique of LSES, and he popularized it. So before itself, this Rennick introduced this lower segmental vertical insertion, but still it was been popularized by Munro Kerr, that is lower segment cesarean section, in the year 1926. So this is all about the world history, how the history has been coming from the ancient period. Like I said when midwifery has been started from the human species emerging, evolution of human species. From then till 1926, there was enormous changes was been happening in the history of midwifery. Very earlier stages, there was nothing. They were only trained by only the deliveries was conducted by DIs, and who were untrained and no skills and no knowledges. But later, slowly they started studying what is uterus, how the uterine structure will be, and then they started learning what is placenta, what is placental circulation. Once after from doing and learning, people explained what are the other things which has been happening in the obstetrics as a nature. When you come about the history of midwifery in India, which is also so important to be, as a students from India, we must be knowing about our own history in midwifery. So in ancient India, India was a very developing country, and during olden ancient period, India was not that much developed, and people were not intellectual, people were not literate, people were undergoing into poverty, and so many social stigmas were there in our ancient India. But still, the women was practicing midwifery, and they were totally in the hands of the village DIs. So any person who is getting pregnant, that's a nature, I said. So nobody taught them how to become pregnant or how to deliver the baby and all. But this was a natural gift or naturally happening thing. But that was a period where the woman who was pregnant and while delivering was unattended, but the neighborhood or a parent or a mother or an close relatives were being acting as a dai to conduct the delivery of the pregnant women in the ancient period. And this time, actually the women were using parda system. So nobody used to see the body of the women. So nobody has the rights to see the genital regions of the women, especially. That was considered as social stigma and sin. So here, there were so many dais were there who were doing this job hereditary. You may know what is dais, I'm telling. Dais are an untrained women who are practicing delivery, conducting delivery hereditary wise. That means if my mother is a dai in a village, then I see her, I go along with her, I practice, and then I become a dai. Then my child will look at me and observe me, and she will become a dai. So there are people, lower caste people in olden India, people were considered as dais by training like this, and especially lower caste people were doing all these time. And because they were considered as an impurity, and even pregnancy and delivery were delivery period is confined as impurity period. So this was being done by the hereditary of lower caste dais, and during the childbirth was considered as a time of impurity, and so the worst room in the household was allotted for the delivery. Okay, so there were, even though the woman who is giving delivery was a king's wife or maybe a richest person wife, but she will not be allowed to deliver in the house where they are living, but the women will be chased into a room which will be dumped with a storeroom or it is outer area. So the dai will be from the lower caste directly come into the household waste room, storeroom, and there the mother will deliver and the baby will be given into the hands of the mother, and the dai will go to her way. So after that, what happens? The dais gain their skill through observation and practice only. As I said if my mother is a dai, I go tag along with her, then I will observe, and then I will start practicing with my mother in small assistance, and then I become a dai. So this is what actually happening in the ancient time during the midwifery time. And when those could not handle the situation, and there becomes many serious morbidity things happen, even those as because they are unknowledgeable persons, or they don't have a particular skill about the what is happening inside, what is placenta, how it will be coming, how it is getting separated, what is the cause of that, is as because the dai is not having such amount of knowledge. She used to handle the mother roughly and according to her way. Sometimes, even while this type of time, while the dais were handling, there are mothers who have been ended up with diseases, or there are children, those who have ended up in death, the mother who had died also. So those times they were called as beyond the human control phenomena. They say it's not nothing about any dai or anybody's wrongness. It was about God has left them. Okay, so it is not in the hands of the human. We'll say no, it's out of human. It is out of my control. It happened just like that. So this was been also called when a dai went wrong and some morbidity or mortality happened. This was said to be like that as beyond human control phenomena. So from this you can understand, if a dai is able to conduct the delivery and the mother and the child is protected, means that is under control. If not, the dai cannot even do anything and it has been left like that. After that, from the king's rule, our India came into the hands of British people, and there came more little changes about the midwifery, and hospitals has been emerging. In the year 1900 AD, that is after the death of Christ, Dr. Ida Sophia Scudder, who was the first person to build up a hospital called Christian Medical College and Hospital, which we call it as CMCH, which is at southern part of India. At Tamil Nadu, at Vellore it is there. It's a famous hospital. Still now it is working on Ida Scudder's name, Dr. Ida Scudder's name. Who is this Ida Scudder? During the British ruling of India, Ida Scudder's parents were at some work in as a British people, as a British authorities, working at Vellore at the southern part of Tamil Nadu, that is South India, at Tamil Nadu, the place called as Vellore. And Ida Scudder was a small teenage girl who visited her parents in her vacation from England. From British, she came to India, to Vellore, and she was staying at her parents' place. What happened one day while she was playing outside, somebody knocked her door and they were been asking for her parents. And Ida Scudder told, my parents are not at home now. Then they said, at least you come. What is the matter? So the matter is like that, the people, those who have come and called Ida Scudder's parents, and calling Ida Scudder was like their wife or their daughter was being suffering, or they are having a labor pain, and there were no doctors or there were no hospitals to conduct delivery nearby. So Ida Scudder is a teenage girl who is not a doctor or who is not a nurse. So she said, I cannot help you. And after some time, again a man ran to Ida Scudder and asked for her help. Same reason, somebody at home is giving labor, is in labor process and was suffering. But Ida Scudder said the same reason, my parents are not there, sorry, I could not help. And the same day, she has been witnessing like that 3 deaths. So as because the parents were not available, and as because there was no hospital nearby, nobody was there to help the 3 pregnant women who was undergoing the labor process. She herself witnessed before her eyes 3 deaths on a particular day. That has given a great impact on Ida Scudder's mind, and she has got a calling for help the Indian poor people by building a hospital. So with that vision, she went back to British, that is to England, and she finished her education in MBBS, and then she came back to Vellore as a doctor, and then with a fund she have collected from British, she started a hospital called Christian Medical Mission Hospital and College for giving trainings for the doctors and nurses. And that was in 1950. Actually 1900 AD it has been started. And after 50 years of time, even males were joining for this trainings. So as we all know, even now, those who are watching my teachings will be a male students also in nursing. So you all had an opportunity from 1950 to undergo this training because of Ida Scudder. And after that, before that also, you can see 1899, Ziana Bible and Medical Mission, started a training of nurses. From the British, there are so many people who has been coming in the name of religious, and they have started so many mission hospitals and training centers for midwives especially. In 1883, Lady Dufferin was a person. She came to India and she started maternity hospitals and training for nurses and midwives all over the country, not only particular place, but she started all over India. And then with the help of the fund that the Lady Reading Health School was established in the year 1918 at Delhi. So the first school of nursing was started in Delhi at 1918 and which was named by Lady Reading Health School. During British period, there was a taboo because British doctors were present at the time of the British rule in India. But the Indian women, we had a taboo that nobody should see the private parts. So if a mother is pregnant and if you wanted to do a vaginal examination to identify the condition of the mother, it cannot be done. So what's the taboo is a male doctor cannot visualize the genital part. So the historical taboo was associated for the examination of female genitalia, and this has been inhibiting the science of gynecology. So watching the genital area, what changes has been happening, whether it is good or bad, nothing was being identified by the doctors during that time because that wasn't taboo among the women that males should not see. And you can see a picture here. This is a person and he is a doctor who is visualizing or he is observing with the hands alone in the female genital area. And this is a procedure. A physician must kneel before the woman and he cannot see her genitalia. So this was something was drawing done by Jacques Perrig-Mayenker, and this was called as a compromise procedure. He is compromising and he is looking after the genital area to identify the changes where he cannot visualize it directly. This was a taboo, and thereby because of such things there were so many maternal mortality rates and infant mortality morbidity rates were increasing in our country. And once after the British people went out of a country and we got independence or republic, midwifery, how the Indian Republic has been making a growth in it. In 1956, the 5 years plans has been started. So many committees were being started, and the first committee was Boer Committee. And these people were making many surveys in the country to identify the reasons of the health status or how the country is in health condition. So they laid a public health planning in India, taking that there are less qualified midwives or the health visitors are less, and thereby there are happenings of more morbidity and in mortality both in mother and the neonates. So in the year after the Boer Committee has given such recommendations, in 1947, along with Indian Nursing Council, the nursing and midwifery courses has been started as a single course. They said, as because lack of training for the midwives are there are increasing chances of mortality and morbidity rates, and thereby they were starting along with the INC, they started so many training schools, and thereby the nurses has been given with midwifery courses and trainings in a shorter and a single course. And after that in 1955, there came a Shetty committee. They also recommended some of the things like ANMs, that is auxiliary nurse midwives has to be there in the healthcare services with the qualifications of 8th and supervised by visiting health visitors. Okay, lady health visitors must be there so that they can be also utilized in the care of the mother at the public and the primary health center levels or otherwise sub-center levels or at the village levels. So according to the Shetty committee in 1955, they have started posting ANMs in the primary health centers. ANMs is a 1-year course where they will be getting a limited amount of trainings for nurse and also for midwifery, and with that classifications like even 8th standard studying people, finished studying or very low class educated people were also considered, whoever knows to read and write were considered as ladies, were considered as lady health visitors, and they also were being given training and sent into the public so that they can at least guide to an extent to avoid this morbidity and mortality rates. And later in the year 1959, Bischoff is a person who supported the training of personnel. So there came training schools and colleges was being evaluated, and from that the trainings for the midwives has been started. You know, A&M is for 1 year and midwifery, that is GNM course for 3 years of course. General, midwife, nursing and midwife program for 3 years has been started. And then in 1975, multi-purpose health worker scheme also launched by Kartar Singh Committee. So this is another committee during 1975. They told that there must be a scheme called multi-purpose health workers so that they can also be involved in giving care to the rural area women who are getting pregnant, and for that adequate care can be provided. So this multi-purpose workers were registered as A&M nurses and were designated as female health workers. So ANMs, after finishing 1 year of course, they joined in the government hospitals and government primary health centers as multi-purpose health workers, and they were called as female health workers, and they were posted at sub-centers for 5,000 rural population. Hope you are getting my point. You might have learnt in your community also. There are sub-centers which is about 5,000 rural population. There will be A&M nurses who will be designated as multi-purpose female health worker, and they will be designated in that name, and they are used for registration of birth, antenatal clinics, immunization, postnatal visits, etc. And they will be supervising the deliveries conducted by the DOIs also. So these A&M nurses or multi-purpose workers will be given training by the government, and they will be liberated into the rural area to supervise whether the DOIs are conducting properly the delivery at the home deliveries or not. So this is about the changes which is happening in the Indian country after before the republic or before the independence, and after the independence also till today. Now after School of Nursing, we have started with colleges like BSc, basic BSc nursing courses started, and we are learning midwifery in that. And after that also we have started with MSc courses, that is PG courses, where midwifery has been a specialized subject in it. So that's how the education also has started improving, and thereby the history of midwifery has to come to an good area, good post where much of the detailed cases and cares has been taken care in our country. And next point we wanted to see is parturition. What is parturition? Parturition is a thing called as a woman who is pregnant and coming to the labor period, and after the labor or after delivery we call that period as parturition. Okay, so this period is the main period to be focused to give a good care, that is pregnancy, labor and delivery has to be taken into account to give a good care so that we can reduce the country's maternal mortality rates, infant mortality rates and perinatal mortality and morbidity rates. As our country is a developing country, when you see the vital statistics, there are so many problems, so many maternal mortality rates, infant mortality rates, maternal and infant morbidity rates has been quite increasing in number. And so if these changes has been happening, then we can accommodate for that, and good healthcare services can be provided. So this is all about the history we have seen till now. And next topic what we are going to see is the current trends.